A good morning, Arizona. In your Health Watch this Monday, we've seen a lot of breakthroughs when it comes to breast cancer treatments. We know the importance of early detection, some modes of prevention, and all of that, of course, stems from research, and that's what we're talking about today. ASU professor Linda Larkey is joining us. She is behind a new study looking to improve outcomes and treatments for women, including the most effective therapies for women who will be diagnosed in the future. And this is really reliant upon the participation of volunteers who will be joining you in this study. So you're here to explain all of that. Thank you so much for being here.
Well, thank you. So I'm with the Edson College of Nursing and Health Innovation at Arizona State University, and I'm the lead on a project that is looking at different ways to help women after they've been diagnosed and then are now survivors of breast cancer. You know, we know this is Breast Cancer Awareness Month, and there is a lot of focus on getting out there and getting mammograms, getting screened. It's a very important part of the process, but we focus more on the research, and we're trying to look at different ways to help women recover after they have been finished with all of their treatment. And some women still continue to have persistent symptoms.
I mean, the damage that the body goes through maybe chemotherapy and through radiation, and also the psychological impact of maybe dealing with the fact that maybe you are not going to survive this, or the heaviness that I imagine, especially women who have lost family members or loved ones from cancers, what they must go through. So specifically, what are you going to be focusing on for this next stage?
Well, you're right about that. There are many things, even women that do not get those treatments, but end up just getting diagnosed and some small surgery. All of those treatments together, along with the stress, does create, for some, a persistent fatigue. And that's the feeling of just not being able to get up out of bed in the morning, the couch potato syndrome. And so we're working on looking at 3 different methods that have actually been shown to help alleviate some of that fatigue and the symptoms of emotional distress.
So I know we have some video of meditation, that being one of the factors, because essentially if you're signing up for this program to be part of this research study, you're going to be participating in a weekly class.
That's true. We have 3 different classes, and 2 of them are movement-based. One that is more just focused on the movement and the precision of movement. One of them
that has Tai Chi, sort of, right?
And then one of them has that meditative aspect to it, you know, where there's a focus on the mind and the breath. And then there's a third one that, you know, I know many of you are aware that breast cancer survivors often get together in groups. And so there's an educational program that allows some social support, and all 3 of those have been shown to have some effect. We're looking at which one seems to work the best, and then understand the elements within those that seem to be working the best.
Well, I imagine, you know, the most wonderful words to hear in somebody's life after they've been through a difficult journey would be, you are cancer-free. But to think that that just erases the experience, not only the physical effects of still recovering, and there are some ailments or some changes in the body that are often quite long-lasting, right, on top of just the psychological impact.
Exactly. Right after getting that clear slate of health, there's still the feeling, why do I still feel this way? And so we have this opportunity for women to join in. We've got 3 years under our belt of recruiting women, and these 3 classes that we randomize women to have been going on for quite some time. We've got 1 more full set of classes now that are starting in January and February, and we would be very interested in having more women that hear about this come and join our study.
Oh, I would just imagine that meeting other people who have been through a comparable journey would have to be of phenomenal benefit.
Absolutely. And we hear that from participants in our study. What a wonderful experience it is to be doing these things for their health along with other women. And so there's information about the study that's on the screen that gives you the phone number and the email address if you're interested, or if you know someone who has had an experience with breast cancer and they're done with their treatment, have them call us. We would love to have you join the study.
Recovery and rejuvenation, those are pretty appealing words for anybody, but especially somebody who's been through a difficult medical journey. So certainly hope that your participants will benefit greatly, and thank you so much for coming here to talk to us about that. So we will make sure that that will be on AZ Family as well. If you are looking to participate, you need about 50 more or so clients starting in January.
That would be great.
Linda, thank you so much. Appreciate your time.
Thank you.